Good morning. I'm George Latimer, Westchester County Executive, and we're on Facebook Live for our 11 o'clock interview. Every day we're having an interview with one of our important people in Westchester County to talk about the status of the coronavirus outbreak in their world, whatever that world is, and to chat a little bit about some other issues that are important. Today we're joined by a very good friend of mine who's doing a terrific job as mayor of the city of White Plains, our home city, the city that I work in, White Plains. Tom Roach is with us. Tom, good morning.
Good morning, George. And you're a citizen of White Plains. When you were in the Senate, you were here all the time, and we appreciated that. And now you're literally here most of the time when you're not driving the county, which is a lot of your time as well. But yeah, no, our relationship has been great over the years. And as we often talk about, if it wasn't for you, I probably wouldn't be in this. So I appreciate everything that you're doing now, and we're working really well with the county.
Well, we're in it together, that's for sure. And,
Absolutely.
White Plains, interesting community in that in the scope of pure population, it's the fifth largest of our municipalities, with some of the other cities in the town of Greenberg being larger. But because of its business population and the very defined downtown that it has, arguably the largest visible downtown in the county, it really takes on a bigger than life importance in the way people view Westchester. This is really downtown Westchester here in White Plains. And under normal circumstances, the streets of this city are very busy during a weekday as well as on a weekend day because of the amount of people that work here, and not just the folks here in this building. So with that thought in mind, what are you trying to do to deal with the social distancing issue, the importance of trying to make sure that we're not getting complacent, even as it appears that we have some flattening out of the curve? We still have a lot of people here in White Plains during the day and on the weekends. And I know that you're trying to do your best you can to stop the spread. How is that working?
Well, I mean, we've done a lot, and it's working well. We're seeing tremendous compliance from our residents. We closed the playgrounds. We've canceled events. The first thing that got canceled was our St. Patrick's Day parade. And at the time, there was some pushback, people posting online, this is overkill and things like that. And I don't think anyone would say that now. We're enforcing the 6-foot distance. I know the schools have closed their athletic fields. We took the rims down from the basketball backboards. We took the nets down at the tennis courts as an added device to try and keep things under control. And we have our field marshal patrolling, our police patrolling, and I patrol too, just to make sure people are complying. And I have to say, really, we're doing well.
From the standpoint of, White Plains' business community, you have a good relationship with the many corporations that are here, the many other institutions. You have the court system is based here. Not only the state and county court system, but the federal court system is based here. You've got some major players right downtown. Heineken USA has their headquarters here. Danone North America, down in yogurt, Evian water for people who care about knowing the products, has their regional North American offices here. So you've got some big corporate players. You have the legal community of Westchester County is based here. What's your relationship been like with the business community in terms of trying to, basically help us for the short term change our lifestyle?
Well, it's been good. I mean, we've had a lot of support in the business community. What came up the most was with our retail and our restaurants, and we've worked with the restaurants. We've created 10-minute free parking bag meters in front of the restaurants to enable them to do delivery and pick up and have people do takeout very easily. And we pretty much add them wherever we're asked to add them to make sure that that's accessible, because that is a lifeline for a lot of the restaurants. So that's worked well. As you know, when the governor gives the press briefing every day, we find out, especially in the beginning, where each day the valve, as he put it, the valve was tightening a little more, and so we were working with that. We had to work with our malls, and we had to make determinations on which stores could be open, which stores needed to be closed, and things like that. And everyone has been cooperative. We really haven't had any issues with any of the businesses. I think people realize how serious this is. Mm-hmm. I think we really have a strong community here, not just amongst the residents, but amongst the people that work here and the businesses that do business here. And everyone's rowing together, and I'm proud of that.
You also have arguably the strongest network of neighborhood associations of any larger community in the county. I think of from Battle Hill to Rosedale to Gedney Farms to North Broadway. There really is a very active neighborhood association structure in White Plains, and many communities don't have that type of structure. How does that structure work within your trying to get a message out and trying to get some compliance?
Well, they have been, some of the neighborhood associations have been pushing out the information that we are pushing out. I do a robocall every night and update people on the numbers and whatever's new. And so that gets pushed out by many of the neighborhood associations. We like that format, the Code Red call, because there is two ways to communicate. There's opt-in, which we're doing right now, and there's opt-out, where someone has to make a determination they don't want to hear the information. And the nice thing about doing the robo every night is that's an opt-out. So we're getting a lot of people, and we're also getting the people who aren't technologically savvy, for whom a phone call is something they're more accustomed to. And that's going to be, particular in some cases with seniors, but others too. And we want to make sure we get the word out to everyone. So the neighborhood associations are another source of that. And I know, because I'm on the mailing list for some of them, that they are pushing that out there as well.
You also have a tremendous institution here in White Plains, and that's White Plains Hospital. It's seen by many as, among the top hospitals in the region, much less in the city proper. And they're a critical battlefront in dealing with people in their hospital who have COVID or other illnesses. And now COVID becomes an additional burden for them, which, makes their situation more severe and potentially fatal. But your relationship with White Plains Hospital, I've seen you there when I've gone there for certain events and activities. So I know you have a good relationship with that team. How is that working within the context of your city policies?
It's working great on so many levels. I have to say that, you and your position have to say they're among the best hospitals in the region. I'll just say best hospital in the region. We're proud to have them here. We work with them literally every day. And this is before this happened. And I think a lot of what people don't see behind the scenes is the importance of the relationships that are developed over the years, so that when the crisis happens, you're not introducing yourself to people. You're calling people you're very familiar with, have a relationship with, and can get things done quickly. When this was first coming online, when we were first getting the information in, and local government is the last stage where it starts with the feds, the state, the county, and then you're down to local, and there's no one we can pass anything to. So we have to kind of solve problems as they come in. And we had that St. Patrick's Day parade coming up, and there's a lot of different information out there, and my gut's telling me we're not going to do it. I say this as an American of Irish descent. We're not doing it, but I wanted to get some medical information, and at the time, the Department of Health this is when the New Rochelle was still just starting to hit. Tough to get people on the phone initially. Now I'm never going to get CDC on the phone, so I call White Plains Hospital. I speak to the head of epidemiology, gave me everything I needed to know, and I was prepared then not just to do what I intended to do, which is cancel the parade, but have an answer for people who thought that was overkill. So that's one example. Also, at the very beginning, we had a meeting with my staff and the senior staff at the hospital to go over everything that they would need, the things that we would need, advice, medical advice. So they've been a tremendous resource, and we've been a resource for them as well. They needed more parking for the emergency room. We bagged all the meters across the emergency room wherever they want them. I usually talk to Susan Fox every day, once or twice a day. We keep each other apprised of what's happening at each end. And so it's been tremendous. And then you move into the quality of the care they're providing, because this is an organization that we often say it's by far our biggest employer. But the quality of the care there is amazing. And I watched, as you mentioned, there's been so much expansion there, and we have worked hand in glove with them on that to make sure that it moves quickly and efficiently, because we value them in our community, and we know that they need the physical plant to match the quality of the care they're providing. And so you get these downtown hospitals, right? It's not like grasslands out where they can add a building. You got to figure it out. Like if you're ever down at Mount Sinai in the city and you have to go to literally you go down to the basement and they have lines painted on the floor of different colors to help you find the CAT scan or whatever. Because over the years they add buildings and it's kind of a hodgepodge, and that's what the White Plains Hospital. If you've ever stayed there, and I have, you'll see the different buildings, and so we've worked very closely with them to make sure that they're able to work within the footprint they have and provide the top care that we know that they do. And if there's ever a time to show how important that is, it's now. So all these, all of the new development that they've done there has always had a component of what if. Hallways that are fitted with oxygen and behind a picture frame that you take down and you can put a bed there when you get overcrowded. All of that looks nice when you tour and you are impressed by is called into play when something like this happens. And so the work they do is tremendous. And I really, I can't say enough. I mean, personally, they cured me of cancer, so that's a good thing. And my two sons were born there. So, but as a mayor and as a resident, tremendous. And we've, never more evident than with what's happening now. And we cheer here in White Plains. We set up these 7 o'clock cheers, and the response to that has been unbelievable. It's also a reminder that the people that work there are our neighbors. They're the people that live among us, that go to work every day and work miracles, never more than what they're doing now. And I think that the cheering that we've done has really demonstrated that, because I know on my block I counted the number of people that work at the hospital, and they range from an experienced nurse who's been there for quite a while, down to a young woman who I was like, oh, she graduated from college, who I've known since she was about 2 years old, who's over there every day in the COVID area as a nurse tech. It's just it's tremendous, and we're so fortunate to have them here.
Well, you've done a great job in linking the that part of the community as well, from the government standpoint to the healthcare area. You're also making a contribution in White Plains, as are we as a county government, by having the county center being fitted out to being a overflow hospital with 110 beds, which you and I toured last week. And I guess we both thought it was a pretty impressive effort by the U.S. Army Corps of Engineers to give us enough beds so that we're sure that we can handle a surge as it may appear. Any reactions to what's happening at the county center?
Well, I think it's an example of all levels of government working together to make something happen quickly. Hospitals being built in 2 to 3 weeks. And for people at home who haven't seen this on TV, George, we were both very impressed. I expected to see Hawkeye and Trapper John and some makeshift rooms and beds in a big room or something. These are built out hospital rooms, 1 patient per room, negative pressure. Built into the wall are the regular electric, the hospital electric, and oxygen. It's really unbelievable to see, and to see how quickly it's going up. And so we're happy to have it in our city. And from the beginning, we said we want to do whatever you believe can help. And because it's county project, federal project, they don't really need our approvals, but they did want our expertise and comments. And everyone from our, from public safety, from buildings, from fire and police that were over there said how wonderful everyone was to work with. And when I went over there, what I heard was the appreciation for the work our people are doing. And, it's basics, water, sewer, all that has to be put in quickly. And it's happening. So we hope we don't need it, but it is comforting to know that it's there. And, I think the goal the governor laid out from the beginning, and I think made clear to all of us, is the goal here is to keep this under control to the extent we don't have our hospital system overwhelmed. And here in Westchester, our people have been working crazy shifts. We now have people from the medical center staying at Cambria Suites. And they are really working, but infrastructure held up. That's the bottom line. We didn't wind up like Italy. and I'm knock on wood when I say that, but it doesn't happen automatically. It happened because these hospitals got their, so they added 50% capacity. Who can add 50? What other business can overnight add 50% capacity? Um, that's probably the hardest business to do it in, and they did it. And they did it to protect our health, to save people's lives, and it's happening. So, having that out at the county center, I went out when they were building it. It was not as bad as today actually, but it was a rainy, cold day, and I went out there. These guys are in the rain, building this thing, and it's going up so quickly. And there was an air of purpose and positivity. You could see people want to do something that helps, and these guys were building a hospital. So, as you said, you and I have been back out and seen it. It makes me proud. I mean, it makes me proud of our county government, and my people, the state, and everyone that was involved to make it happen. For me, growing up in this area my whole life, I remember going to the county center as a kid. I remember hearing about my great grandmother, who was first female employee in the White Plains Police Department, was a matron. But she and her sister, my mother used to tell us, would go to the wrestling matches at the county center and bring hat pins. I don't even want to know what happened with the hat pins. But so over my time, right, I've seen basketball games there. I've seen Muppet performances there, music. I've been there for all kinds of tabletop exercises with the county to prepare for what we're dealing with, which have certainly come in handy. And now, this grand old building is poised to save lives. So I think it's all in all just a tremendous thing. And as I say, I hope we don't need it.
I think we'd both be very happy if the building lays fallow during this period of time and we never get to the point of surge where it has to overflow. And if somebody said patient one never walked in the door at the county center, then I would say that our infrastructure held, but we're planning in case it doesn't hold. And we know that as a baseline, we have 3,000 plus hospital rooms in Westchester County. The additional amount of hospital rooms being brought online, let's assume it's at that maximum 50%, that puts you up at 4,500 rooms or something like that. This additional 100 some odd rooms with the 4,600 level, our hospitalization rate right now in the county, not rate, but we're probably hospitalizing right now about 1,200 COVID patients countywide. So we're well below what we need. But what we saw in China and what we saw in Italy was that the need exploded and swamped the system. So hopefully these infrastructure decisions will make it possible for us to handle the surge as it happens. And none of us really knows how long this is going to go on for until the day comes where we know there's a vaccine to treat it or an antiviral to deal with the people who have the disease. We may see COVID in our world for quite a while. And what we're also watching is that it really is a killer for people of a certain age and older. You're a younger man than me. I'm closer to that demographic that has been most affected by this. But to have the additional hospital beds is part of what we need to have in order to deal with it. And we're happy that the very same place that a month ago, I had a chance to see the Section 1 finals after being gone for a couple of years. We got them back.
Good job on that, George, by the way.
That was one of our small victories this year.
Yeah.
We may only have small victories from this point forward, but it was great to know now that lives could be saved in all of this. Just in closing out, Tom, any message, obviously for the people of White Plains that are watching this, or the greater audience of the people of the county that are watching this, from your standpoint? What message would you like to leave with us today?
Just stay with it. I mean, so today I'm driving to City Hall, and the wind is whipping, the water is shooting up the street, and there's 3 Verizon trucks working on something that's out of service. I saw the other day coming up Mamaroneck Avenue, a guy down a manhole by Con Ed. And then, of course, you have the city employees. Our sanitation workers are out there today in this wind, picking up the trash. Haven't missed a day of collection. Our police, our fire out there every day. These nurses and medical professionals putting their lives on the line, ambulance personnel. And I always get in trouble when I make the list, because literally I will get a text. You forgot about
occupational hazard.
Everybody's out there, right? So if your job is, to stay home and be careful about your contact with others when you do go out, you put that in comparison to what these people are doing for us to make sure that we can do that. And think about the people, many people have lost their income and are struggling with that. So if you're fortunate enough to be in the circumstance where neither of those apply, where you're able to stay home and you have income, then bear that in mind. But I do believe that what we're seeing is tremendous compliance. I'm seeing it in White Plains, personally going around to check things, and it's just become part of the conversation. I close every one of my robocalls with, remember that we're standing together by staying apart, and people have taken it to heart, and you see it, and I think we need to keep it up. I'll also throw out to you, we are seeing for the employees that went out COVID positive, a majority have now returned as recovered. And so I'm presuming that's out there in the community too. Mm-hmm. So if you are one of those people, you really should consider donating your plasma because it can save someone's life. It's the New York Blood Center. I believe it's nybc.org, but you can look it up or you can email me. That's something that you can do now. We're White Plains. We have a lot of people volunteering. Volunteer at whiteplainsny.gov, and we're working on food banks, getting food out to people in every way we can, and we want to keep that up because not everyone has income, not everyone can leave their home, and so pitch in as you can, but you're already pitching in if you're staying home and observing the protocols that everyone's put out there. I love my city, I love my people, and we're going to be coming through this together. The sun's going to come out again, and probably we'll all come out more slowly. We're going to get there, but we need to stick with it. There is an inclination when the news starts to get positive to get right back out there. But if we do that, we're going to be right back where we started, and we don't need that. So that's my message. Thank you for everything you're doing. You're making me proud as mayor, as a resident, as a fellow resident, making me proud. Thank you, George, for everything you're doing at the county. If people knew how much we could get done by picking up a cell phone right now, they'd be surprised. Between the access I have to county government, state government, White Plains Hospital, it's been tremendous.
Thanks a million. It's really a pleasure to have you on, and to you and the 65,000 people or whatever the magic number is in White Plains these days. We 60. Really appreciate 70.
I got all I can handle.
Okay, but we're very happy to be here and working together. We thank you for watching. George Latimer, Westchester County Executive. We'll be back at 2 o'clock today for our official coronavirus update. We're also going to touch on weather conditions, which are going to be very severe today. Severe wind, heavy rain. They will pose a problem in a number of set spots. As we're speaking now, still in the morning before 12 noon, there are some power outages. Hopefully we'll have an idea of what we can share with you come 2 o'clock. But thank you for watching. And I think Tom Roach said it as well as anyone else can. We stand together when we separate apart, or however he phrased it, but he said it very well, and we'll follow that outline. Have a terrific day. We'll see you again at 2 o'clock.